please. Are you ready?
Yeah.
Cat scratch disease.
Good morning. The topic of my presentation today is cat scratch disease infection. Author Kulikova Alexandra, teacher Veronika Savinska. Plan of my speech. General description, pathogens and transmission routes, diagnostic methods, methods of treatment and prevention. General description. Cat scratch disease is an infection caused by bacteria called Bartonella hensleyi. In rare cases, another bacterium, Ephipia felis, can also cause it. The disease spreads through scratches, bites, or even licks from infected cats, especially kittens. It is more common in children and young adults because they tend to interact more closely with cats. Infections are more frequent in winter.
Recording stopped. Recording in progress.
Men are slightly more affected than women. Cats carry the bacteria but do not get sick themselves. Cat scratch disease cannot spread from person to person. Bacteria and how it spreads. The main bacteria, Bartonella hensleyi, is difficult to grow in a lab. It spreads through scratches or bites from infected cats. Contact with cat saliva on broken skin or mucous membranes. Flea dirt, as fleas can carry the bacterial between cats. When the bacteria enter the body through small wounds, they travel to the lymph nodes, causing swelling and inflammation. In rare cases, the bacteria can spread to other organs like the liver, spleen, eyes, or brain, leading to more serious complications. Diagnosis. Doctor's diagnosis based on patient history, recent contact with cat, especially scratches or bites, symptoms, a small sore to the side of the scratch or bite, followed by swallowing and tender lymph nodes. Tests. Blood test to detect antibodies against the bacteria. PCR test to identify bacterial DNA in tissue or blood samples. Biopsy of lymph nodes.
Recording stopped.
No problem. You have so nice pronunciation.
Recording in progress.
Biopsy test. PCR test to identify bacterial DNA in tissue or blood samples. Biopsy of lymph nodes to check for signs of infection. A skin test, though that is really used today. CSD can resemble other diseases, such as tuberculosis or lymphoma, so accurate diagnosis is important. Treatment and prevention. Mild cases. Most cases resolve on their own within 2-4 months. Pain relief and warm compress can help manage symptoms. Severe cases. Antibiotics like azithromycin or doxycycline may be prescribed, though their effectiveness is debated. In rare cases, surgery is needed to drain swollen lymph nodes. Prevention. Avoid rough play with cats to reduce the risk of scratch or bites. Wash hands early after handling cats. Control fleas on cats. There is currently no vaccine for CSD. Possible complications. Most people recover fully, but complications can occur, especially in individuals with weakened immune system. Eye problems. Paranoid ocular glandular syndrome or neuroretinitis. neurological problems, encephalopathy, meningitis, or seizures, systemic problems, swelling in the liver or spleen or bone infections, vascular problems. In immunocompromised individuals, the bacteria can cause unusual growth in blood vessels. After recovery, most people develop lifelong immunity to CSD. No deaths have been directly linked to this disease. Is reference. Thank you for your attention.
Thank you very much. Very good.